Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. Before we get started, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter, which is the text for this video. It has all of the news links, all of the medical research links, as well as a number of healthcare-related resources, and of course the actions that we take. They're all in there. You can subscribe for free. Let's get started. It's the new year, 2025. Research from the past 12 months has pinpointed some of the lifestyle factors that are linked to living longer, healthier lives. Welcome to New Year's resolutions. No surprises on any of these. Eat less red meat. Cut out salt. Follow a Mediterranean-style diet. All of these have been consistently linked to longevity. Exercise, as little as taking a walk on a daily basis, could help prolong lifespan, and several studies are now shedding light on the mechanisms through which physical activity slows down the aging process. Social activity, incredibly important. It turns out that people who are chronically lonely or feel lonely and those who are socially isolated face a higher risk of early death. There is a whole host of mounting evidence on this. Now, we've heard about diet and exercise forever, and they really do matter. But there is a study that shows that if you're isolated, you have potentially worse health, including an increased risk of stroke, and that should be in the newsletter. You can go read that. I included the source article for all of this so you can get as in-depth as you want about all of these nice recommendations for the new year. They all come from the National Public Radio. I want to talk a little bit about atrial fibrillation. It is incredibly important because it can be absolutely deadly. British researchers have developed an artificial intelligence tool that can actually identify people at risk of the serious heart condition before symptoms appear, potentially preventing thousands of strokes. The BBC reported this in The Hill. The AI, it's in the Hill newsletter, but it's from the BBC. The AI system was developed by scientists at the University of Leeds and Leeds Teaching Hospital at the NHS Trust. They analyzed electronic health records to detect warning signs of atrial fibrillation. It's a condition that causes irregular and abnormally fast heart rates. The tool examines patient data, including their age, sex, ethnicity, and any existing medical conditions like diabetes or high blood pressure and heart disease to calculate an individual risk. The algorithm was trained using anonymized health records from over 2.1 million people and was validated against a test set of 10 million additional records, according to Sky News. You know what? Let me go off script here and tell you, when you have universal health care and access to records, you can get preventive research that will help people live longer and better. If you don't have it, you have no access to the data, you won't make that kind of progress. I want to talk about Cigna, the healthcare giant, because they're an insurance giant, because they have speeded up one of their processes, and that process is denying claims. I want to recall how health insurance works. Let's take a primer on this. Insurance companies receive premiums from policyholders. The insurance companies invest the money to make more money. What they don't pay in claims, they keep. That's profit. Now, denying claims, requiring pre-authorizations for treatment, that delays treatment, and sometimes dictating what treatment is appropriate, no matter what the doctor has ordered or no matter what is accepted medical practice, are some of the ways that they keep costs down, that is, spending down. Other schemes are to build medical networks with whom they have set reimbursements to guarantee their profitability. So that's health insurance. On to the story. Cigna has been found to have increased efforts to speed up claims denials using new software and performance measures that pressured medical directors to close cases without a full review, according to a ProPublica investigation. Of course, there's a link to that in the newsletter. The insurance company reportedly pressured medical directors who fell behind in reviewing cases and threatened to fire them if they failed to work faster. This is according to Debbie Day, who's a physician. She's an MD, and she worked at Cigna for more than 15 years. Often, the company encouraged doctors to cut and paste the denial language that a nurse had prepared and quickly move on to the next case. That is, don't even think about it. Just take what the nurse says and close it. This practice became so common at Cigna that employees took to calling it click and close. The company reportedly measured the pace and total number of cases that each medical director closed, which involved a productivity dashboard that tracked performance. Day told ProPublica the only way to keep up with expectations was deny, deny, deny. You could not actually read and think about them. And they are required to do that because they're supposed to evaluate the claims based on the individual. But Day told ProPublica that she believed her work was too important to speed through. Medical directors at Cigna were given the responsibility to approve or reject payment requests for critical care, such as complex surgeries. And while the insurance company was pressuring doctors to work faster, Day said the work of the nurses was getting sloppy, which made reviewing claims harder and more meticulous. Cigna told ProPublica that medical directors are not permitted to rubber stamp nurse denials, and the company expects case reviewers to perform thorough, objective, independent, and accurate reviews in accordance with our coverage policies. I believe Cigna? Not at all. This is another problem that universal health care fixes. I want to talk about cancer detection in the UK. This story is again from the BBC and describes advances in cancer detection in the UK. The proportion of patients diagnosed with cancer at an early stage has risen to the highest level on record, according to the NHS in England. Data for the 13 most common cancers show that 58.7% of those diagnosed between September 2023 and August 2024 were identified at stage 1 or 2. That increases their chance of survival. This is a 2.7% increase. It's up from before the pandemic, and it is the highest since records began being collected on this 10 years ago. The NHS said a combination of public awareness campaigns, new screening approaches, these have all made a big difference. This is big news, and we could have this kind of early detection if everyone would be able to get to the doctor. Think about universal health care, because that's what makes this work. That's what I've got for you. Down below, you can like, share, and subscribe. You can send me comments, requests for research. You can also send them to me at healthcareadvocacy1@gmail.com. Have a good day.